Namaste everyone, welcome back to my channel Physio Vitals. I am Dr. Ankita Sawant and today we'll be diving into an essential topic for healthcare professionals and patients alike, which is on chronic obstructive pulmonary disease. So we'll discuss its anatomy, physiology, pathophysiology, its investigations, treatment, and most importantly, the role of physiotherapy in its management. So let's get started. So, COPD, chronic obstructive pulmonary disease, understanding and managing a chronic lung condition. So, COPD affects millions worldwide. It causes airflow obstruction and breathlessness, making daily activities challenging. So, this presentation provides an overview of COPD, encompassing its causes, symptoms, and management strategies. So today, first we'll be understanding its anatomy. So COPD affects the respiratory system, particularly the bronchi and the bronchioles. Okay, so bronchi and bronchioles, which are the airways, which are responsible for carrying the air in and out of the lungs. So these are the pathways where the air is carried in and out from the lungs. Okay, then the alveoli, a tiny air sacs where gas exchange takes place. Then the diaphragm and the other respiratory muscles which aid in breathing. So these structures are integral to the proper functioning of the lungs, and damage to them plays a key role in COPD. So we saw the airways. The airways include the trachea and bronchi, which carry the air to the lungs. The alveoli, which are the tiny sac which are responsible for the gas exchange. Okay, oxygen exchange occurs. The diaphragm, a muscle that contracts and relaxes to control the breathing. So the physiology aspect of this thing is normal respiration involves inhalation and exhalation. So for inhalation, where the oxygen enters the lungs and diffuses into the bloodstream. Exhalation, where carbon dioxide, a waste product, is expelled from the body. So this process relies on the elasticity of the lung tissue. Very important. So inhalation, exhalation, the whole process relies on the elasticity of the lung tissue and clear open airways. Very important. Elasticity of lung tissue and clear the open airways. In COPD, airflow is obstructed. So the disease itself named as chronic obstructive. So the airflow is obstructed, leading to difficulties in gas exchange. Okay. Now we'll further move to the pathophysiology of COPD, its causes and progression. So the COPD includes two primary conditions, the chronic bronchitis, which is the inflammation. Very important. Chronic bronchitis is inflammation and mucus build up in the airways. So we have the airways. So there is inflammation and mucus build up. So this is chronic bronchitis. Then emphysema. This is the obstruction of the alveoli, deeper structures. In emphysema, there is destruction of the alveoli, reducing the surface area for gas exchange. So due to the destruction in alveoli, there is reduce in the space of the alveoli for the gas exchange. So the key pathological changes includes the loss of lung elasticity, which I just mentioned in anatomy. Loss of elasticity, lung elasticity, narrowing of the airways due to inflammation, hyperinflation of the lungs, reduce oxygen and carbon dioxide exchange, which leads to hypoxemia and hypercapnia. Hypercapnia is basically building up of the carbon dioxide in the blood. Okay, now major risk factors include smoking, exposure to the pollutants, and genetic predisposition. Example, alpha-1 antitrypsin deficiency. So this was all about the pathophysiology, like smoking, which I just mentioned, the primary cause of COPD is smoking. It damages the lung tissue, damages the elasticity. Inflammation. The chronic inflammation leads to airway narrowing and mucus production. Then airflow obstruction. the lungs cannot efficiently remove air, causing shortness of breath. So now moving further to the investigation. The clinical presentation and diagnostic investigation is to diagnose and monitor COPD. Commonly we do spirometry, which measures the lung function and the airflow obstruction. Spirometry test, chest X-ray or CT scan, CTs if required. So this identifies the lung damage or hyperinflation. Then ABGs, arterial blood gas analysis, which evaluates oxygen and carbon dioxide levels in the blood. Pulse oximetry measures the blood oxygen saturation. So in symptoms we see chronic cough. The patient represents with a chronic cough, shortness of breath, wheezes is present in COPD and chest tightness will be there. You need to examine patient's chest thoroughly, structure wise. Then chest X-ray, which provides the image of the lungs, revealing the signs of COPD. Spirometry, a test measuring lung capacity and airflow, confirming COPD diagnosis. Blood test assess करता है overall health and identify any underlying conditions. So all these investigations, examination is very important. Pharmacological intervention for COPD management. So medical treatment, bronchodilators to relax the airway muscles. Due to inflammation and mucus buildup, there is narrowing of the bronchus, right? So there is obstruction of the airway due to such things. So we need a bronchodilator to relax the airway muscles. Then corticosteroid to reduce the inflammation. Then antibiotics. For infection like pneumonias or anything, we need antibiotics if required according to patient. This is a general treatment, pharmacological treatment which I am mentioning. Oxygen therapy. For advanced cases with severe hypoxia, we need to give the patient oxygen therapy. In worst cases, ventilator is required. So lifestyle changes we need to make sure is smoking cessation, the most critical intervention. Nutritional support to maintain the energy and immune health. Surgical options, very rare. Lung volume reduction surgery, in worst cases we need to do that. Lung volume reduction surgeries or the lung transplantation in severe cases. So bronchodilator, which relaxes the airway muscle, improves the airflow. Corticosteroids reduces inflammation. Oxygen therapy, as I said, if required, supplemental oxygen when blood gas levels are low, hypoxemia. Okay. Now, very important part of this lecture, the role of physiotherapy. So physiotherapy plays a vital role in improving the quality of life in COPD patients. Breathing exercise, very important. Pulse lip breathing to reduce the air trapping and improve ventilation. So air trapping is reduced due to pulse lip breathing and this improves the ventilation. Diaphragmatic breathing to enhance diaphragm function. Okay, so in breathing exercise we need to prescribe the patient pulse lip breathing and diaphragmatic breathing. Then airway clearance techniques we need to do, and in that we have postural drainage. Every postural drainage position varies and you need to do a thorough you need to have the thorough history of the patient before giving the PD positions, or you need to see if this particular patient is fit for PD or not. And increase ICPs and all, we cannot take the patient in such positions and give chest PT. So postural drainage, I'll be covering postural drainage in upcoming videos as well. So in airway clearance techniques, postural drainage, percussions, vibrations are important, which removes or centralizes the mucus from peripheral to center, and the patient can expectorate and remove the mucus out. So this was airway clearance technique in which we give chest PT, that is postural drainage techniques. Pulmonary rehab, it's a combination of exercise training, education and support to improve the physical and emotional well-being of the patient. Exercise training, aerobic exercises like walking or cycling to improve the cardiovascular fitness. Strengthening exercises for peripheral muscles to reduce fatigue. So in exercise training we need to give aerobic exercises and strengthening exercises. Then education and lifestyle guidance. Training on proper inhaler techniques. Train your patient to use proper inhalers. Then strategies for energy conservation to improve the breathlessness. So that should be nicely, patient should be educated about that. So breathing exercises, muscle strengthening, pulmonary rehab, airway clearance techniques, exercise training, education and support should be provided to the patient. So chronic obstructive pulmonary disease is a challenging condition, but with timely diagnosis and proper treatment and consistent physiotherapy, patients can lead to a better quality of life. So thank you for watching. I hope this video helped you understand COPD better. If you found this content valuable, don't forget to like, share and subscribe to my channel Physio Vitals for more such, and stay tuned for more such informative videos. See you in the next video. Take care and stay healthy. Keep learning. God bless you all.